Hello, everyone. Good morning, depending on where you're watching me from. I'm still your favorite nurse this morning, Nurse Mimi that always care. I'm a registered nurse, a registered midwife, a registered mental health nurse practicing in UK. I recently passed my NCLEX with that 85 questions. Yeah, so I'm now a registered nurse in US, a registered nurse in Canada, which I have their peace. Congratulations to me. So I'm here to talk about a quick vital information that I wanted to share. It has been bothering me. I said, let me share with you guys. What is that quick information today? Medication error. How many of us are guilty? I know a lot of us are guilty about this, but I'm here to talk about it. Don't worry. I'm here to talk about it. You need to make people to trust you. You need to make your colleague to trust you. You need to make the world to trust you. That's why they said nurses are standard. Nurses are wonderful. Nurses are great. So if you're working in healthcare sector, don't scroll past this page. Don't scroll past this page because this information is for you. It's going to help you, help me, help entire world when we stick to this. The topic is medication error, like I said before. What are you supposed to do when this error occurs? What are you supposed to do as a nurse when this error occurs? Because I'm coming from experience. What happened to my friend? She called me and said, look at what happened, and I gave her these steps, and I believe it worked out for her because at the end I got a message which she was telling me thank you, appreciating me for my time and the effort and the advice I gave her. So what are you supposed to do in case if you do medication error, be it any type of medication error, any type at all, underdose, wrong labeling, wrong patient, please ensure your patient safety. That's the first thing. Ensure your patient safety. Monitor the patient vital signs. Monitor the patient level of consciousness. Check the symptom the patient is having. Is still the same with what the patient came with? Is it the same thing with what the patient came with? So don't hold any information for your patient, please, I beg you. Then secondly, after you've ensured the safety, you report to the appropriate channel. Report this to the appropriate channel, either to the prescriber, the nurse in charge of that shift, to your manager, but don't escalate it. Don't escalate it. Remember, I forgot to tell you to be calm. You need to be calm. Because that's what I told my friend. I told her, calm down. You need to be calm. Don't just rush into decision. Think of what has happened. So by the time you reported to all these people, remember I said, report to the prescriber, report to the nurse in charge. If you are not the nurse in charge of that shift, report to your line manager, telling them what you've done. If it's a wrong dose, you tell them. Then monitor the patient. As you are monitoring the patient, please communicate to this patient. That's the third step. The third step is monitor the patient. As you are monitoring this patient, please try to communicate what you are doing. Try to communicate. I know most patients will be anxious when you tell them, I did a medication error. The what I'm supposed to give patient A, I gave it to you. They will be anxious. They won't be themselves again. Some of them will even hold your neck. But don't worry. The way you speak to them in a calm, cool voice, maintaining eye contact with them, explaining that you've done this error and these are the steps we are following to solve this error. These are the steps you are following to correct this error. After you've done that, please document it. Document it. Documentation is very, very crucial in healthcare. Document it. If you document it, the next person coming after you will know that this is what you've done and you've corrected it, and the patient, the nurse or the next person behind you will just focus on that patient to make sure everything is okay for the patient. Please document the error. Follow the hospital policy, follow your facility policy, and document the error. Document the error, please. Don't hold it. Be a truthful nurse. When you are doing this error, when you are correcting it, you are trying to show them, I am truthful. Remember the ethical principles in nursing, which is veracity. Please stand to it. Stand to it. Communicate the error. Don't allow your left hand to know you are lying. Please document it. After you've documented, you've communicated, you are monitoring the patient. Please make yourself available for reflection to prevent future errors. Make yourself available for trainings. Make yourself available for anything that will help you. Then you check for the contributing factors. What led to this error? What made me, what caused this error for me? Is it wrong labeling? Is it wrong identification of patient? Is it that I didn't follow the five rights of drug administration, which all know right patient, right drugs, right dose, right route, and right time? Is it that I did not follow that? Then you make sure after reflection, you do what we call strategy double check. Strategy double check. So that whenever you are giving your medication, please you try to double check before you give that medication so that such error will not happen again. Such error will not happen again. Please, let's try to save people. A lot of medication error has killed patients. A lot has killed patients. Please, let's be careful what we are doing. Let's be careful where we are practicing. Let's be careful and try to be truthful. When you do all this, you are not trying to bring yourself down. You are trying to tell them, I'm a truthful nurse. I'm a truthful nurse. So that's what I want to share about today, medication errors and ways to correct it, following my friend's experience. So I'm waiting for the comment section your questions and your questions so that I will be able to answer it. Okay. So see you some other time. I'll be coming to share some educative tips as time goes on. Bye.